This is Dana. She came to us about 3 months ago after over a year of wooziness and probable cervical cranial syndrome, which can cause the wooziness, even stomach upset and neck pain. I don't know if you had headaches, oftentimes with headaches.
A little on and off, but not too bad.
But she'd had a year plus problems, and she has some disc bulges in her neck. And tell us your story, kind of what you were like before you came here, what you tried, and what all has happened.
It really started kind of with the dizziness and the, like I said, indigestion and stomach issues kind of presented a few months later. And so, I went to my general doctor and had blood work done, and then had a brain MRI. Ended up in the emergency room with some of the stomach stuff. I ended up going to the balance center to try to see if it was my eyes, ears, nothing checked out there. I did some physical therapy with them. Started with an upper cervical chiropractor, which I think helped, but I wasn't able to hold my alignment because of some of the neck stuff that was going on. So that's when I found you guys in November.
And we started with Prolozone, and first the upper cervical chiropractor noticed you were holding better. And then kind of tell us what we've done. 4 treatments, 2 Prolozone, 2 Prolotherapy with ozone.
And then kind of the brain fog and some of that stuff that I was having just slowly started to lift. I started, like you said, to hold my alignment better, slept better, like just slowly kind of made it, progress towards feeling good again, normal again.
Okay, and you said too that you had better energy and mood.
And that all started to come.
Neck pain went away.
Right. And I did also use, besides injections, the posture pump to kind of help with the disc as well.
Because she had a straightening of her cervical spine, so that helps get that curve back. Dana had symptoms typical of cervical cranial syndrome, which is cervical, neck, cranial, the connection between here, and the sympathetic nervous system that runs down here. It often comes on with whiplash or degenerative disc disease, which she had 3 bulging discs, narrowing and flattening of the curve of her neck, which changes the mechanics of the neck. She has cracking and popping in the neck that's resolved with her treatment. But often they'll have wooziness, dizziness, ringing in the ears, feeling off, stomach, GI problems, all kinds of symptoms that people think are unusual or they can't explain, and they think there's something, it's just in their head, but it's not, it's in their neck and head. So what we did Prolozone in the muscles at first to calm things down, then Prolotherapy, little deeper injections to stabilize the spine, and she did very well. She has no grinding in her neck, no neck pain, no wooziness, no dizziness. She had brain fog, which is a typical symptom where you kind of can't focus. So she's done very well, and this is a typical case of cervical cranial syndrome that can come on with no cause. Hers was degenerative disc disease, not an injury. Sometimes whiplash, sometimes disc bulges, disc herniations, or arthritis in the neck. And now you're kind of done.
Doing good.
Okay, I'm glad we could help.
Yes, thank you so much.
You're welcome.